Now, during the Trumpcare fight, Senator Bernie Sanders had promised that once this is over, once we've defeated Trumpcare, we're going to start talking about our own healthcare plan, my healthcare plan specifically. Okay, well, now that that's happened, Bernie Sanders has honored this and has now decided to release the details of his new plan. And of course, unsurprisingly, it's Medicare for all. So those of you unfamiliar and that are now just getting warmed up to the idea or are interested in the idea of, hey, let's actually look at a progressive healthcare plan, I have some details. Now, the plan, according to Sanders, will reduce the cost of healthcare for families and the government overall. So with that promise in mind, again, this is an entire transforming of the healthcare system as it currently is. So I'm going to go through essentially the policy points, how much it costs, what it's going to do, and why it's actually better than not only Trumpcare, but Obamacare as well. So, as I said, on Sanders' site, he claims that his plan will actually lower the cost of healthcare by $6 trillion over the next 10 years. Now, he writes, the United States currently spends about $3 trillion on healthcare every year, nearly $10,000 per person. Reforming our healthcare system, simplifying our payment structure, and incentivizing new ways to make sure patients are actually getting better healthcare will generate massive savings. So again, this plan will save $6 trillion over the next decade. Well, okay, some people might have some questions here. Wait a minute, if you're going to cover everybody, how's that going to be cheaper? I don't quite understand how that's going to work. And I didn't know we were spending $3 trillion. What we hear from the Republicans and from the some centrist Democrats is that Bernie Sanders' plan is going to cost trillions of dollars extra. Well, that's actually not true. That's actually replacing the entire system, but not with something that doesn't exist yet. We already have it. The building block in place is actually called Medicare. All you would do is you would expand it to everybody. So, and look, I remember Chelsea Clinton going and lying about this and saying, no, you're just going to rip out Obamacare and have to start new. But we already have the system in place. Again, that's Medicare, and all you would have to do is just expand it to everyone. It's fairly simple. Now, on the how much money it's going to save, again, you might think, no, that's fantastical. There's no way it's going to save $6 trillion over 10 years. That's crazy. Well, I'll show you where he gets those numbers. Now, this is according to an analysis by Gerald Friedman. He's an economist at the University of Massachusetts at Amherst. Now, he found this number he found actually that if you eliminate insurance companies, you eliminate their tax breaks, you eliminate the subsidies, and you take out all the other bullshit, and you institute a single-payer plan where the government pays the healthcare providers directly, you end up saving a lot of money. Again, that's very, very different than what we currently have now, where we have a basically multiple payer system. Okay, we don't have a single payer system. We have actually maybe a third payer system. So right now, the government does pay in systems like Medicare and Medicaid and Tricare, etc. But you also have insurance companies that are also payers. And then, of course, what those don't cover, you end up paying. So, okay, now all of those disappear under a single payer system. Literally, you just have the government. The government will pay the healthcare provider directly. And so instead of dealing with insurance companies, the government just pays. And you don't have to worry about any of it. You just go up to the doctor or you show your insurance card and that's it. No bill, no deductible, no insurance company to argue with. You get in, you get your healthcare. Okay, wonderful, great. Now, how does that save money? Well, it saves money because right now what you pay in premiums doesn't all go to your healthcare. A lot of it goes to, or well, I shouldn't say a lot of it, but some of it goes to executive bonuses and others go to advertising costs. In fact, I've got some numbers on that. Now, right now, insurance companies spend about 15% of their total expenses on just advertising. That's something that the government doesn't have to do. Not only that, but administrative costs actually create an enormous overhead when it comes to private insurance. Now, when you compare that to Medicare, Medicare currently spends about 2% of their total expenses on administrative costs. The insurance industry, the private insurance industry, spends 12 to 14% of their total expenses on just overhead costs. And that is of the typical insurance company. Now, the government, as I said, they don't need to do any of that. They don't need to do advertising. They don't have executive bonuses. They just have a very small administrative cost, because all they're there to do is just to pay the doctor or pay the hospital. That's why you end up having cheaper costs. Now, right now in America, we actually spend a lot more per person on healthcare, and we get less results than other countries. And that's per capita. So, now, speaking of savings, right? How much money will the average family save? Well, the typical middle-class family is found to have saved, or will be found to have saved over $5,000 under this plan. He writes that last year, the average working family paid $4,955 in premiums and $1,318 in deductibles to private health insurance companies. Under this plan, a family of four earning $50,000 would pay just $466 per year to the single-payer program. That amounts to a savings of over $5,800 for that family per year. Again, that's the average family. Well, what about businesses? Everybody's worried about businesses, right? This will actually save businesses money too. How much? They would save nearly $10,000 per year in healthcare costs for the average employee. And the average annual cost to the employer for a worker with a family who makes $50,000 a year would go from $12,591 to just $3,100. Again, that is a huge reduction in cost. The burden will be placed off the employers. They might actually be able to create jobs with that. Imagine that. Now, the next question, of course, is how much it will cost the government overall. Now, of course, they're going to be worried about that. Republicans are screaming about the enormous cost. Oh, my God, it's just going to cost so much. It's going to explode. It's going to make the budget explode. Okay, everybody watch out. The budget is going to be busted. The plan is estimated to cost a total of $1.38 trillion a year. We currently spend $3 trillion. That's a huge savings. That's much less expensive than what we're spending now. And you might ask, how's that possible if we're going to cover more people? Well, think about it this way. Let me kind of break it down into something a little bit simple, right? So right now, a lot of uninsured people, they don't buy into the health insurance market. Why? Because they're not sick. I mean, that's why we put in the individual mandate, so we would get those healthier people to buy in. Okay, so the case before the ACA is that you had a lot of uninsured people that just chose to be uninsured. Now, some did buy insurance that were healthy, and they paid it into the system because they wanted peace of mind. And then you also had the sick people. Sick people, of course, had to have insurance because they needed that insurance, but because there were more, the way that insurance worked before is that since there were more sick people paying into insurance and people had the option of not buying into insurance, it made an imbalance in the prices. Now, like I said, the ACA actually came in to try to fix that imbalance by putting in an individual mandate. That's unfortunately unpopular because you had to buy insurance, and insurance was expensive. A single-payer plan would be less expensive for all the reasons that I pointed out before. So, but the way that it would make a single-payer plan work better is that you would still have that mandate, but instead of paying in premiums, it would just come out of your taxes because everyone would have to buy in. It would be mandatory, but it would be taken out of your taxes. Okay. Now, that would, of course, make it cheaper overall since everybody will be paying in, and most people aren't sick. There's a small minority of people that have pre-existing conditions that are sick that will require more care. But since you'll have so many other people paying in through their taxes, And of course, the richer you are, the more you pay in taxes to support the system, the cheaper it is for everybody else. And not only that, but you have the government having the ability to negotiate drug prices and to negotiate, to use their leverage with pharmaceutical companies and hospitals. So it's going to, of course, bring down the costs as well. Now, speaking of taxes, right? So how do we pay for this? Well, they would pay for it with a 6.2% income-based healthcare premium paid by employers. Now, how much would that raise? That would raise about $630 billion per year in revenue. It would also have a 2.2% income-based premium paid by households. That's supposed to raise about $210 billion a year. Now, now you might be worried, like, wait a minute, I don't make that much money. Do I have to pay the tax? Why are you going to tax me? Well, fortunately, if you don't make that much money, you will be exempt from this tax. And they give an example. A family of 4 taking the standard deduction can have an income of up to $28,800, and they will end up not paying the tax. Now, what about your average middle-class family? How much is going to cost you? Well, a family of 4 making $50,000 a year, taking the standard deduction, would only pay $466 this year. Now, compare that to some of the yearly plans from health insurance companies. How much it would cost? $466 versus the rest of the money, right? Versus what you would pay under a private insurer for health insurance. And by the way, under single payer, you do not have a deductible. Okay. So that's how it saves you money, and that's how much you would end up paying. Now, it would also have progressive income tax rates. Now, that revenue would raise about $110 billion a year in revenue. Now, these marginal tax rates would be 37% on income between $250,000 to $500,000. So, again, if you're under $250,000, you don't pay any additional tax other than the 2.2% income tax. Okay. Now, you also have 43% on income, tax on income between $500,000 to $2 million. 48% of income between $2 million and $10 million. And in 2013, they note under only 113,000 households, the top 0.8% of income of percent of taxpayers had income between $2 million and $10 million, and a 52% tax on income above $10 million. And now only in 2013, only 13,000 households just had 0.1% of taxpayers had income exceeding $10 million. Now, so there's your tax breakdowns for your brackets of how much you would pay and who would pay. Now, they would also tax capital gains and dividends the same as income from work. And that would raise about $92 billion a year. So right now, that raises so much money because capital gains is only taxed at 15%. Now, the plan would also end the special tax breaks for capital gains and dividends and household income above $250,000. It would also limit tax deductions to the rich and raise quite a bit of money from that. It would also have raise money from the estate tax, about $21 billion per year. It would tax the wealthiest 0.3%, the 0.3% of Americans who inherit over $3.5 million at progressive rates and close loopholes in the estate tax. It would also save money from health tax expenditures, raise about $310 billion a year from that. And most importantly, of course, healthcare provided by employers is compensation that is not subject to payroll taxes or income taxes under current law. Now, this is a significant tax break that would effectively disappear under single payer because all Americans would receive healthcare through the program instead of an employer. So there's a lot of details in this plan. So anybody who says, well, they don't know how to pay for it, there's an incomplete plan, and we just don't know. No, that's a complete plan. They're telling you exactly how they pay for it, all the way down to the tax brackets they would institute. So that's a lot of details. Okay? So Americans, you guys got to look at the options here. Because the whole, discussion shouldn't be Obamacare versus Trumpcare. Okay? Because those two programs at their core is sort of the same principle. Market-based insurance. Now, Trumpcare is way more destructive and way more damaging, way more right-wing. But at the same time, Obamacare is also built on that same, we got to let the insurance companies in, we got to make sure that these guys make a profit and deliver most of the health care, because we don't want the government to do it, because they can actually do it cheaper, and our donors happen to lose out. No, it's that system versus single payer. That needs to be the discussion that we're having. So now that we've, for the moment, saved Obamacare, we need to have a discussion of what kind of system that we'd rather have. So look at the facts, look at the different plans that they're offering, and you should come to your own conclusion about what kind of system you'd like to have. A market-based system based on profit, or a healthcare system that actually delivers cheaper, affordable health care and not health insurance. Your choice, America. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.